Hello, dear doctors, nurses, med students, and healthcare team. How are you today? I hope you are well. Here we are going to talk about another question about cardiology. Okay, a 55-year-old man presents to the emergency department with palpitation, chest pain, and dizziness. An ECG was performed and is shown below. What's the single most likely diagnosis? This is the patient's ECG. Okay. A. Supraventricular tachycardia. B. Ventricular tachycardia. C. Ventricular fibrillation. D. Atrial fibrillation. E. Atrial flutter. According to the patient's ECG, as we can see, F waves or flutter waves in the patient's ECG, and its pathognomic, we say this one Sawtooth pattern, and this is pathognomic for atrial flutter. Here we are going to talk a little more about atrial flutter. Okay, explanation. If you look at these ECG leads, you would see the characteristic flutter waves, which are a sawtooth shape, as we said, and the flutter waves replace the P waves here, and this is pathognomic and characteristic for atrial flutter, sawtooth pattern, or flutter waves. Okay, what is the difference between atrial flutter and atrial fibrillation on ECG? Okay, atrial flutter. In atrial flutter, the activity rate of the atria is 220 to 350 beats per minute, but in atrial fibrillation, the atrial rate is increased severely. It's more than 350 beats per minute, as we can see in this ECG. Atrial fibrillation, the atrial rate is severely increased, and we cannot see any clear P wave. Okay. In atrial flutter, we can see F waves or flutter waves, as we can see here. This is F waves or flutter waves. But in atrial fibrillation, we can see fine fibrillatory or F waves, and this pattern is called fine fibrillatory or F waves. The ventricle contraction in atrial flutter. In atrial flutter, the ventricular rate is irregular, and we have constant or interval, as we can see in atrial flutter. The or interval is constant, and the rate of the ventricles are regular. But in atrial fibrillation, the rate is variable, as we can see here. The rate of ventricle is variable, as we can see here, and there is no relation to atrial rate, and or interval are variable also, as we can see here. Okay, the baseline pattern in atrial flutter is sawtooth pattern, but in atrial fibrillation, the baseline pattern is rugged, and this is pathognomic for if the baseline is rugged. This is pathognomic for atrial fibrillation. Okay, here was a short explanation about atrial flutter and the differentiations between and the differences between atrial fibrillation and atrial flutter on ECG. Thank you for your attention.